many forms of validity in research. In general, validity refers to how sound your research design and method are. We are going to talk about two types of validity: internal validity and external validity. External validity refers to how well the findings of our study can be generalized to other populations and settings. After all, the purpose of research is to learn more about the world at large, and not just about our specific group of participants or what goes on in our lab alone. It would be great if we could just study everyone in all possible contexts, but unfortunately, our access is typically limited to a small population of participants and a single context or situation. However, we still want to be able to take our findings and say with a degree of confidence that they represent what goes on outside of our study. That's what external validity gives us. A lack of external validity means that our findings cannot be applied to other people or other contexts outside of the study we performed, or that application to other people and contexts is limited. For example, if we only had white males participate in our study, our findings might not apply to females or non-white races and ethnicities. So, while external validity refers to factors outside of our study, internal validity, on the other hand, relates to the validity of measures within our study. It depends on factors such as: did we capture the construct that we intended to with our measure? Was the independent variable really the cause of the changes in the dependent variable? Or did we control for all other possible factors that could have affected our results? A lack of internal validity means that our findings may not necessarily reflect what we think they do. For example, our study may have looked at the effect of pet ownership on mental health. But let's say that, unbeknownst to us at the time, the type of pet has a significant effect on whether or not the owner will experience mental health benefits. If we did not control for the type of pet in our study, then our findings do not necessarily reflect what we think they do, and our study lacks internal validity. Let's review some common threats to external and internal validity. This is by no means an exhaustive list. Rather, here we just have 3 examples of threats to external validity. Remember, anything that reduces the generalizability of the study results to other populations and settings will reduce external validity. Let's take a look at participant characteristics. The question we want to ask is, do they represent the larger population we want to generalize to? For example, a large majority of studies in psychology recruit undergraduates looking to get extra credit in their courses. However, these participants may differ from the larger population in a number of factors, such as age, IQ, and socioeconomic status. Setting. The research environment is typically a very controlled and artificial one, very much unlike the everyday world that we want to generalize our findings to. It is important for studies to be able to control all possible extraneous variables to be sure of the relationship between the independent and dependent variables. But this does come at a cost of external validity to a world in which the variables of interest will almost always occur in the presence of other extraneous variables. And timing. The world changes with time, and so studies conducted in the past may not have external validity to the world today. For example, a study conducted 60 years ago on sexism in the workplace may have produced very different results than a similar study conducted today. And what about threats to internal validity? We'll go over a few more here since internal validity can involve such a wide variety of factors within a study. So the thing to remember here is that anything that reduces the study's ability to establish a relationship between the dependent and independent variable reduces its internal validity. So starting with selection bias. Selection bias can be a problem for the same reasons that participant characteristics can be a problem for external validity. If we are comparing two groups of participants, we want to make sure the two groups are as similar to each other as possible at the beginning of the study, so that differences in the characteristics of participants don't affect our results. For example, if one group consists of college undergrads volunteering for extra credit, and the other group was recruited from flyers at a local arcade, we may find that the two groups differ in their level of education, motivation, and possibly IQ. Not saying that those who hang out at the arcade have low IQs, just that there may be a larger proportion of individuals with higher IQs in a group that is pursuing an education and putting forth the outside effort to earn extra credit. Next we have sample size. Having too few participants in the study can mean that the statistics don't have enough power to produce results we can trust. In other words, our findings are more likely to be the result of chance if we are basing them on only a few individuals. Confounding. This occurs when an extraneous variable we did not control for has an effect on our results. In other words, something other than the independent variable is affecting the dependent variable. And history. History refers to events outside of the study or between a pre-test and a post-test having an effect on how participants respond. This could be something as significant as a natural disaster or as simple as a participant reading a book on memorization skills during a study on memory. Maturation. Maturation is a natural process in which participants change between a pre-test or post-test or during the course of a study in which multiple measurements are made. It may simply be that they got older in a study that spans years, or that they became fatigued or hungry during testing. Maturation is similar to history in that both affect how a participant responds in a study, but they differ in that maturation is internal and is a natural course of things, while history has to do with an external event of some kind. Instrumentation. This occurs when the instrument or measure we are using in a study changes in some way over the course of a study. If the measure is different at the beginning than it is at the end, it could possibly be producing different results. Instrumentation can occur, for example, if an experimenter decides to tweak a test to make it better, or if the springs on a scale start to wear out. It can also occur in observational measures if the observer gets better with practice at detecting certain behaviors over the course of a study. Next we have testing, also sometimes referred to as practice effects. In studies that use the same or similar measure for a pre-test and a post-test, run the risk of practice effects. If a participant is given a math test for a pre-test and a post-test, she is likely to perform better the second time since she has seen the test before. It could be a matter of the participant getting better with repeated practice, or it could simply be familiarity with the test that leads to better performance. And finally, we have attrition or mortality. Attrition refers to participants dropping out during the course of a study. Not only does this become a problem for sample size, but there may also very likely be a reason that some participants drop out and others continue on with the study. For example, participants who drop out may have a more difficult time with transportation to and from the location of a study, and therefore may be of lower socioeconomic status. This factor that differs between those who stick around and those who don't may have an impact on the sorts of findings we end up with. If the study involves a pretest and a post-test, the group who took the pretest at the beginning of the study may differ from the group who took the post-test at the end. Also, the factor determining which participants are still in the study may be exerting a sort of selection bias on the characteristics of the participants our results are based on, which is a threat to the internal validity of our results. But this can also create a threat to external validity if the participant sample our results are based on differs in a significant way from the general population. With careful consideration of the potential threats to internal and external validity when designing your study, you should be confident that your results reflect a true relationship between your dependent and independent variables, and that those results are generalizable to most other populations and contexts.